Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio at 866-870-5752. And when you call the program, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate, with 264 scientific studies, and the foreword is written by the lovely Suzanne Summers. And here we are. Do you want to talk to Joe in Alhambra?
Yeah, Joe, I do want to talk to you. Please be patient for another minute. I know you've already been patient. A couple things I want to talk about. Number one, I want to get some more callers in here. We usually get a ton of callers right at the end of the show, and I don't have time to talk to you, so I appreciate if you can call me right now, talk to me live at the studio. It's 866-870-5752. I'll repeat it for you while you scribble it down, 866-870-5752. If you don't want to call in, if you're shy, you can always use a fake name, but if you are shy, you can call my office at 800-300-9300. That's 800-300-9300. I'm going to give out a free copy of my book, Regenerate, Don't Operate, Stem Cell and Platelet Therapy. If you call in now, it's a $25 value, so please call. I want to talk to you. And I want to give out the website again. You can watch me doing these procedures on videos at www.lastemcells.com, lastemcells.com. And very quickly, Joe, thanks for hanging. I just want to do something real quick here. I just got an email at 7:54, and it really hurts my feelings to look at this. And I want to get it out to you guys. So this is someone that wrote in and said, I have severe arthritis in my knee after 2 surgeries. Okay, why someone would get 2 surgeries on their knee, I have no idea if the first one failed. Nevertheless, it says, thank you for responding. The damage to my right knee is all due to ways you listed in your website, sports, traumatic injury, 2 surgeries. The first in 2003, the second in 2014. The surgeon told me after my second repair that it, and this is in quotes, it looked like a bomb blew up your knee. Well, guess who the bomb was? And there's photographs here before and after the surgery. After the surgery, we can see that the surgeon took out just hunks of cartilage. Now, I don't think that's a great idea. There's a lot of people that have pain in their knee, that have meniscal tears, whatever it is, who don't need to get surgery. We use regenerative medicine using platelets from their blood or platelets and stem cells from the bone marrow and get them worse. Yes, even with things like meniscal tears, rotator cuff tears, labral tears, supraspinatus tears, rotator cuff, you name it. So we have what I'm going to call an aggressive surgeon here. And what I see all the time, people bring in their photographs of their arthroscopic surgeries, and I think to myself, my God, why did that surgeon take out all that tissue? We don't want to take that tissue out, okay? So I'm a little bit upset right now. Excuse me, I get a little emotional about these things. I know there are times we need surgery, no question about it, but in the musculoskeletal system, anything from arthritis, neck pain, back pain, shoulders, arms, wrist, fingers, all the way down, hips, joints, the knees, the fingers, the toes, whatever it is, the ankles. Most of these surgeries do not need to be done. Our culture is, at this time, surgery. I know that. We've got to change the culture. I've been working on this stuff for the last 25 years of doing regenerative medicine. I am not liked by the surgeons. They say that what I do is false. That's fine with me. I've got a lot of happy patients. If you want to go to Yelp, YELP.com, and put in Marc Darrow, you're going to see a lot of reviews about me. I think there's a few hundred. Most of them are pretty amazing. There's a few bad ones. I get a few bad eggs in the office, and I always tell people, and I have them sign something, there's no guarantees. Most of the time we can help. Anyway, Joe, you've got shoulder pain. I'm sorry to hear that. How long has that bothered you for?
Since 2010.
Okay. So we've got about almost 12 years of pain. And what did the doctor tell you about it?
I had surgery. I'm a bus operator for Los Angeles Metro. And
Okay.
I slipped and fell back in 2010, and I broke my fall when I fell right on my tailbone in a sitting position on the pavement. And I broke the fall to my head by putting my elbow down, which caused whiplash. And I had a rotator cuff problem at that time. So then surgery was done about 2000, I think, 14, 15 on my right shoulder. The surgery did not take. It did not hold because I'm 70 years old. At that time, I think I was 68.
Okay.
I'm 70 years old now. I'm still working, still as a bus operator. Now my left shoulder has a lot of pain. I've been awarded a stip on my settlement with the company, so I go through physical therapy once a week. It's hard to get that because of the bureaucracy. But anyway, they do give me like 10, 12 visits with the physical therapist. It's not chiropractic. The doctor is very, very good. Because of him, I'm able to continue to work the following week. But I asked about the stem cell to him and to other doctors, and they say it doesn't work. But well,
of course they say that because they don't do it and they don't know what they're talking about. Excuse me for interrupting.
Sure.
God, this gets me so crazy sometimes.
And I've been listening to your show for about maybe 2 years now, and I've been meaning to call you, and I finally got through this morning. So happy to talk to you. And
great. I'm so happy to hear you too, Joe. Do you mind if I take a minute and just respond to all of this information?
Sure.
Okay, so I'm so sorry you had your fall. That's terrible. And I'm sorry your shoulders are bothering you. And being a bus operator, my God, your shoulders, are normal for hurting, right? You're using them all day long.
Yeah.
But think of it like this. If your shoulders are a tire on a car, and how many miles are you going to get on that car before they wear down?
Right.
60,000?
Yeah.
20,000? Depends, how fast you drive. It's the same thing with all the joints. The more they use them, the more they wear down. The nice thing is, have you ever heard of a tire being retreaded? They don't do it much anymore, but when I was a kid, I'd see signs all over the place, retread your tires.
Right.
All we do is retread your joints. We can help grow the cartilage back. We can help repair the soft tissue. We grow collagen. That's what these procedures do. It's a simple injection. You walk in, you get an injection, and you walk out. It's nothing like surgery. I'm not saying surgery is never needed. If you have a broken bone that's sticking out of your arm, you better get right to the emergency room. But something like you have is just really an overuse syndrome, and we can usually help that. I'm not going to promise you anything. I don't promise any patient anything. Some patients get mad at me, and they go, "How come you're not my cheerleader?" And I go, "I'm not here to be a cheerleader. I'm here to tell you my truth. And my truth is this works on a lot of people, and there's reasons it doesn't work. Overactivity after a treatment, you got to chill and let it heal, right? Taking anti-inflammatory medicines like ibuprofen block the inflammation that we need to heal. Not getting enough treatment. My orthopedic surgeon buddies will do it one time to somebody, and it didn't work. It did work. It grew some tissue, just didn't do enough of it. And they say, now you need the surgery. Another reason is you get a bad doc, a guy who doesn't know what they're doing. You got to go to anybody you want to see in medicine. Go to someone who does the most of whatever it is. Don't go to somebody that a chiropractor hires to come in for a day, who could be a nurse or a doctor who doesn't know what they're doing. And the final thing is, for shoulders like yours or knees or hips, you definitely have to have someone inject using an ultrasound to look inside the body and show where the needle is going. You've got to hit the right spot. The studies show if you don't use an ultrasound in those areas, you're not going to get into the joint at least 1/3 of the time. Okay?
Okay. So is the ultrasound for your for your treatment, or is this like when they do cortisone shots?
No. The ultrasound is an imaging. It's like a live X-ray, but there's no X-ray.
Yes.
It's just sound waves that show me what's inside. And there's a screen.
Okay.
I show my patients. They actually see the needle moving. And I show them where the target is, and then we go for that target. In a way, it's like shooting a rifle. You know, you've got a target, and you've got to line up the needle along the probe to get to the area. Then you can watch it go toward the target.
Okay, because I also had 7 herniated discs on my back when I fell off that time, and they wanted to do injections on my spine. I said, is it guaranteed? They said, we'll try on one spot one time, and we'll try another spot another time, and we'll try to locate the right one. I said, I don't want to be a guinea pig and have you tell me you're going to do one spot and that's the spot, I'll do it, but not different spots, different days.
How is your back feeling now, Joe?
I have back pain. I'm 70 years old. You know, I'm accepting the fact that I'm, you know.
Do you have any pain down your legs?
I have pain down my legs. In fact, sometimes it feels like I'm being bit by a bite on the back of my leg. So hard that I almost start crying.
Yeah,
now,
I believe you. It's painful.
Yeah. And,
so, Joe, listen, we got a bunch of callers. I want to finish up here with you. Your herniated discs may not have at all happened from your fall, okay? They may have been there for 20 years. A lot of people have herniated discs. They don't even know it because they don't have any pain. When you have pain, when you fall on your tailbone, man, that hurts. That dislodges all the ligaments, loosens everything up. I had that happen to me too. I was about 22 years old, and that hurt like you know what, the dickens. And I had my back injected with regenerative medicine. I am fine. I'm going to go play golf later. I ran last night in the dark, and I am fine. My back is fine. So I'm betting anything that those herniated discs are not the issue with your back pain, okay? So there's good hope with all these things you're talking about, and God bless you, Joe. I really appreciate the call.
I have one quick question.
Sure.
Would workmen not pay for the injections that you
sometimes they do.
For your treatment?
Yeah.
Okay.
Sometimes they do. Yeah.
Okay.
If you have a nice adjuster, they pay for it. Yeah.
Great. Okay. Great.
All right. God bless, man. It's good to hear.
Thank you very much.
And good luck with your healing.
Okay. 866-870-5752. Call right here in the studio and speak to Dr. Darrow directly, 1-866-870-5752, and get your free book. Patricia in Fullerton.
Hey, Patricia, Dr. Marc Darrow, how are you today?
Oh, same as normal, just, waking up. Since I take Lyrica, would that interfere with any of your procedures?
Not a bit. A lot of people take Lyrica that we treat. It's not even an issue.
Uh-huh.
I'm wondering why are you taking Lyrica? For pain?
For neuralgia on the face.
Oh, okay.
Yeah.
Does it help you at all?
Yeah. It's helping
Good.
me, but it makes me feel like a zombie right now.
Yeah, that's
So
the
I
thing.
need to
I can hear that in your voice, and you need to go to your doctor and change medicines. That's not a good medicine for you.
Oh, I see. But I'm fogged up from waking up, too. So, anyway, I'm usually not this.
Let's talk about your knees, because you mentioned that your knees and your back are bothering you. Let's start with your knees. How long have your knees bothered you?
My back is causing so much pain that I can't stand. And, and I stand or walk or bend a lot.
Okay.
Then I've got to sit down right away because the pain is excruciating. I've been having pain in my back for about 5 years. I thought it started with a bulging disc, and now I don't know what it is because it goes into my left buttocks.
Yeah.
Also.
Okay. You want me to talk a little bit and explain some things, or you have more you want to tell us?
And then with the knees, they're very bad. I let them go. So, but I still can bend them, but I know they're not. The surgeon told me, why did you wait so long? And that was like 3-4 years ago.
Okay.
Because he says if I had them operated on, I wouldn't have a lot of movement in them. And so I wonder if they're still viable for the stem cells.
If you can move them, what's the big deal? Sure, we can grow some more tissue. Hopefully we can make you feel a lot better.
And then for the back, like the discs are snapping and popping when I bend over.
Yeah, the discs are not snapping and popping. That's ligaments. And you said you had a disc bulge. Disc bulges don't cause back pain. And I will bet you anything, I haven't examined you yet, but I'll bet you anything your problem is you have a sprained back, like a sprained ankle. They're very painful, but they're very easy to fix.
Well, I hope so. I've heard you talk about that before. But the disc would not be, if they're getting smaller from old age, drying out?
It's usually not the problem, no. Degenerative disc disease doesn't generally cause pain. It's the ligaments that are sprained that cause the pain. There's a lot of people out there with degenerative discs that don't have any pain at all. So I have to examine you. In 1 minute, I can touch your back and your knees and let you know what's going on and see if using stem cells or platelets or both can help you heal up. My guess from what you're telling me is that you can feel a lot better using these regenerative medicine treatments and not having to have surgery.
Okay, and I'm on a blood thinner, so if you get your knees injected, you have to be off it for so many days before you get them injected.
It depends what it is. It's something we talk about. You can call the office at 800-300-9300. I'll repeat it for you. 800-300-9300. And they'll talk more about the blood thinners and what we can do and what we can't do. What are you taking a blood thinner for? Is it a heart issue, atrial fibrillation or something?
Yes, it's atrial fibrillation. And I also now, the last year or so, I've developed heart failure.
Okay.
So heart's not working as well.
Okay.
So would that
sometimes people have a short stint of atrial fibrillation. They're put on a blood thinner, and then the doctor never checks their heart again. They're not in atrial fib anymore. So you have to go check it and see if you still need that blood thinner. You don't want to be on a blood thinner if you don't need it. Okay?
I know, but they're very reluctant in taking you off it, I think.
Okay. All right. Well, that's between you and your doctor, but make sure you at least ask and make them check your heart, because you may not have atrial fibrillation anymore.
Well, he checks it when I go in, and he didn't say.
Okay.
He didn't say if I did or not, but mine, I can be in it, and then I can be out of it,
Okay. Do you drink caffeine or eat chocolate or things like that with caffeine? Good. Okay.
Oh, I like chocolate, but I'm not supposed to be eating it.
That's two of us.
It sounds like you are, eating it.
Oh, well.
You're not alone, Patricia.
Yeah. Did they ever consider doing an ablation in your heart so they could get rid of the atrial fibrillation?
Yes, but we did not go for it.
Okay. Anyway, a lot of issues. I'm not a cardiologist. I know about all that stuff, but I'm not going to advise you what to do other than to check it out. You don't want to be in a blood thinner. I wouldn't want to be.
I know.
What happens if you bump your head?
What happens if you bump your head?
Yeah.
I don't know why. What happens?
Well, I'll let you think about it. Go look it up on Google. What happens if you bump your head and you're on a blood thinner? Go look it up. What happens if you fall down? Figure it out.
Thanks. More things.
All right, Patricia, God bless you. Thank you so much. I'm going to give out the phone number to the studio to talk to me right now. We've only got a few minutes. It's 866-870-5752. Steve, thank you so much for calling. You have a question about testosterone. Tell me, what is it?
Well, just that I heard you speak about how at a certain age it's lowered, and you've been on it for a long while, and I'm wondering, how do you get that? Do you take pills? You inject yourself, or how do you do it?
You never take pills for testosterone. Okay, that irritates the liver. You do either a cream, which I don't like because it converts to estrogen and dihydrotestosterone, which are both not good for you. Okay, so the best way to do it is with a shot in the butt once a week. You do it yourself, a skinny needle that you don't feel.
Okay, and then you just have your doctor prescribe that to you? Is that how you get it, or how do you get the...
I don't know many doctors that know how to titrate and give testosterone. Okay, so when you say you just go to your doctor, no, you go to an expert. Like if you go to a surgeon, you go to an expert surgeon who does that particular thing. All right?
All right, is that something that you could help with?
I certainly can. But I don't do it for people
well
unless
then
they're
I'll look into that. The other thing I wanted to tell you, I don't know if the screener told you today, is Suzanne Summers' birthday. I know you're a big fan, and
I already wished her a happy birthday. Thank you very much.
I'm glad
happy birthday, Suzanne Summers. God bless you too. All right, Steve, we're going to move on to Eddie, who's got a left toe that's bothering him. Which toe is it?
It's my left toe.
I know, but which left toe?
My fat toe, the joint.
Which one? The big one, the little one, the middle one?
The big one, the big fat toe.
The big baby. Okay, so it's your first toe. It's your first toe. And is it growing in size? Is it a bunion?
It's swollen, it's red. I want to fade. It's kind of turned purple. But
you better go to your doctor right today. Eddie, listen to me. If your toe is swollen and purple, go to your doctor right now. I can't help you.
No, I did already, but it's going down already.
Do you have gout?
Yes.
Okay, well, that's the answer. Your doctor already took care of it. If you've got gout arthritis in there, I can help you. We'll inject some platelets or stem. I would love to meet you, Eddie. You sound like a cool guy. The phone number to the office, you can call right now. It's 800-300-9300. I'll repeat it for you. 800-300-9300. We can rebuild the cartilage in that toe.
Do I have any future damage or future problems as I get older?
I don't know what you're going to have. I haven't even met you yet. I got to touch it, take a look at it.
I'm going to be there. Remember me,
okay.
Eddie Spaghetti.
Eddie, I haven't had breakfast yet. You're making me hungry for spaghetti. Okay, Eddie, God bless you, man. Thanks for so much calling. We're gonna go to Jimmy. He's got a lower back problem. What's up, Jimmy? How long has it been there? This is Dr. Marc Darrow.
Jimmy, are you there?
I'm here.
How long has your back bothered you?
For about 5 months now.
What happened?
It's a really bizarre situation.
I love bizarre. Tell me.
When I've been sitting, I started feeling some weird thing, and then it started getting worse, and pain emanating from the tailbone all the way through the rear end and to the perineum area. And then so I went to different specialists, and finally, after 67 years, discovered I have spina bifida colta.
That's not the problem. We got to run. Why don't you just call the office at 800-300-9300 or go to my website at www.lastemcells. You can email me there. Thank you, Nita. Thank you, Alex. Thank you, everybody there, Suzette. And God bless you all.
Thank you, Dr. Darrow. And thanks for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.